We have criteria. We have two different criteria for how we are determining whether somebody's recovered. And it is the same across BC, but I will address one issue in a minute. So initially, around the world, we were using, after symptoms have resolved and you had two negative tests, so the nucleic acid test, the NAT test that we're doing, at least 24 hours apart. And we are still using that criteria for people who are hospitalized because they have more severe disease, or for people who are immune compromised because we know they can shed virus for longer periods of time. But we also have what we call a clinical criteria, recognizing, as we did at one point where lab testing took some time. We've also recognized, as we've learned around the world more about this virus, that some people can actually shed the virus for periods of time, but it's not live virus, so they're not going to transmit it to others. And there was a couple of papers, including one out of Germany, that helped us look at that, and essentially they were not able to find live virus after 8 days from symptom onset. Once people's symptoms had resolved. So this is for people who have a mild illness, so which is a large proportion of the people in BC who've tested positive. So if you have a mild illness, you're at home, your fever has resolved, your everything except sometimes people have a lingering cough that may go on for a period of time, and you're otherwise well, you're back to your normal activities, and it's 10 days since your onset of symptoms, then we consider people able to be out of isolation and recovered. So that's the criteria that we're using across the province. There was a point when Vancouver Coastal was just using the algorithm for mild disease, and they didn't have a physician oversee some of the reports, and it turned out that not everybody after 10 days had their symptoms resolved. So we went back and recalculated that number in the daily follow-up with people. So it was so there was a bit of a reckoning that happened last week to make sure that we weren't over-including people. And there were some people who had mild disease, but their symptoms progressed and lasted longer than 10 days. So we're still concerned that they might be able to transmit it to others. So they aren't considered recovered until their symptoms resolve completely. So that's kind of the complex criteria we use. In terms of whether people have, we have had people who've early on, particularly with people with mild illness, we were testing them. They had to have two negative tests, and we found that people would be negative and then positive and then negative and then positive, and then sometimes it went on for some time. We now know that it's very unlikely that they will shed virus that could infect others, and that's been shown again in South Korea recently, where they've had upwards of 80 or 90 people who, after a period of time, tested positive for the virus again. But again, not having symptoms, and it's not clear that they are infectious. Well, it does not appear that they're infectious to others. So we're still learning a lot, and it's sometimes complex, so we have to try and keep on top of all of the different combinations and permutations that happen.